Good morning, everyone, and thank you for watching today. My name is David McHale, and I'm a urologist and robotic surgery fellow at Lenox Hill Hospital in New York City. My presentation today is about a voluntary utilization surgical skill assessment tool that we have implemented at our health system called CSATS. I have no disclosures. Just a little bit of background. As we know, robotic surgery utilization has been increasing exponentially over the past decade. About 75% increase in general surgery alone since 2015. That being said, credentialing varies significantly across US hospitals, with most addressing proficiency based on volume and proctoring rather than objective measures or outcomes. However, it has been established that in minimally invasive surgery, surgical skill is linked directly to patient outcomes. CSATS stands for Crowdsourced Assessment of Technical Skills and is a validated surgical assessment tool. Currently, it is meant for surgeons to get feedback from trained assessors and other surgeons regarding their surgical techniques and decisions during minimally invasive surgery, usually used in robotics. When a surgeon submits their case to CSATS, the case is separated into key portions and evaluated based on GEARS criteria. Thus, the surgeon gets a score between 5 and 25, encompassing the 5 domains of GEARS. And they also get a percentile based on the procedure and a comparison to their peers. And finally, they're given a quartile based on this percentile. CSATS has been validated as a reliable tool for assessing surgical skill acquisition, predicting surgical skills in trainees, and predicting functional outcomes and complications with specific procedures. However, most studies evaluate one or a few videos for a group of surgeons, and there is limited data that exists regarding applicability across a hospital or health system. At our health system, CSATS has been available for the past 2 years. We have a total of 16 hospitals and about 111 surgeons that are currently doing robotics. We excluded 10 surgeons that had not performed more than 5 procedures and were not submitting to CSATS. We looked at 4 specialties: urology, obstetrics and gynecology, general surgery, and cardiothoracic surgery. When we compared these 4 groups, we see that there was significant differences between the utilization rates between the different specialties. For example, general surgery had only a submission rate of about 26%, and this was statistically lower than the other 3 groups. When we compared average scores, we see that gynecology was slightly higher, even though there's quite a narrow distribution of all the scores. As you can see, our lowest average is 19.85, while our highest average is 20.36. And the question remains as to how clinically significant this really is. Similarly, gynecology had a slightly higher average percentile at 56% compared to the average of 53%. This was what we were most interested in seeing, was whether or not voluntary enrollment or utilization of CSATS would continue to rise as surgeons became more aware of the tool. And we saw this across all 4 specialties, with an overall increase of about 145% between 2018 and 2019. The question remained whether or not utilizing CSATS more often led to higher scores. And we did see significant improvement in scores in 3 specialties, namely gynecology, general surgery, and thoracic surgery, while urology stayed around the same. And this could be linked to the overall learning curve within each specialty, since urology has been using the robot the longest. Similarly, this was seen with an improvement in percentile when compared to peers. We saw that the 3 specialties had a statistically significant improvement in their percentiles from year 1 to year 2, and urology stayed about the same. Finally, we wanted to see if the CSATS score correlated with a surgeon's expertise and overall experience. And we found that there was a positive correlation with surgical volume over 6 years, and their average CSAT scores. In summary, we were able to use a voluntary surgical skill assessment tool, CSATS, and implement it successfully across the health system, with surgeons increasing their use over time and the scores increased significantly as well. We see that it is linked with overall experience that the surgeon has in robotic surgery, and thus it is a valid tool to assess their overall capability. In the future, we want to correlate these scores specifically with the surgeon's outcomes, as well as with the outcomes from a specific case, and we're working on this at our institution. Thank you for watching, and please don't hesitate to contact if you're interested in collaborating. Thank you.